Last September, I came home from work and I found her passed out on the kitchen floor. She was just so limp I couldn't pick her up, but I just laid there with her for a while.
I met Kim in November of 2021. Kim had headaches that occur when she stands up and that are alleviated when she lies down. And that's very consistent and common with CSF hypotension, cerebrospinal fluid hypotension. Your brain floats in a pool of clear liquid, and when it's floating, it's at ease, it's comfortable. But if it's not floating because there's too little CSF, that creates a lot of tension on the part of the brain that's innervated with pain fibers, and that can be really, really painful, cause disabling headaches, disorienting headaches. And that's what Kim was dealing with.
I worked for over 20 years, never called in sick a day in my life. All of a sudden, I had the headaches that were so severe that I couldn't get out of bed. It's like someone's taken a chisel and chiseling away. I was nauseous all the time. I wasn't eating, got down to under 100 pounds.
They were pretty convinced that Kim was losing cerebrospinal fluid from the nerve roots along her spinal cord. But she had these cysts at multiple levels, and they weren't convinced which of them represented the site of the loss of CSF. She had had more than 10 of these blood patching procedures done at multiple levels in her thoracic spine, and had sometimes gotten relief, sometimes not. But inevitably, it was a temporary relief. So my colleague, John Stone, who's another neurosurgeon in our department, was managing Kim and heard about this diagnosis of a CSF venous fistula. And he said to himself, I wonder if that's what's going on for Kim.
Dr. Stone said from day one, I don't want to operate. It's just going to cause more problems. But he had heard from a visiting neurovascular surgeon that they had done the procedure and they felt that they had good results. So he went to Dr. Bender and said, would you be willing to try this?
When Dr. Bender told me about this, I said, this is my last shot.
The procedure that we performed for Kim was called a DSM. What the DSM allowed us to see was that just one of these was the site of the fistula, of that abnormal connection that was responsible for all of her problems that she had been dealing with for 5+ years. We followed it down to the exact site where we had seen the leak. And then we watched as we slowly injected the glue to occlude the vein into which the CSF was escaping, to block it off. We were encouraged. When the day afterwards she said she wasn't experiencing headaches, we were cautiously optimistic. I felt more and more confident that we had given her a durable solution. We met up 3 months after her surgery, and she said still no headaches, and that had transformed her life.
Dr. Bender is my angel, and I'm there's no words to say how grateful I am. I'm beyond grateful. I would like to just say to Dr. Bender and his whole team, thank you for the second chance at life. You are such a blessing. You will always be an angel to me. I mean that from the bottom of my heart.